Attracting and keeping healthcare professionals has been top of mind to locals ever since the indefinite closure of the ICU department at our hospital. But in fact, there have been local groups focusing on it for some time.
About 2 years ago, some of the doctors in town set up a health summit, and we've had individuals and people that represent organizations. So we've had the city, regional district, medical professionals, School District 70, North Island College, Community Futures, a number of people around that table attend that over the course of a couple of years, identifying what are the key elements or assets needed to be in a community to attract the medical professionals.
What they identified was housing, daycares, a purpose-built clinic, and technology.
When we put those together, it could be done potentially individually, a bit here, a bit there around the community, but it makes so much sense to have it together in a campus setting. And around that time, that's when we had Mike Rattan, who's very experienced and has been successful in development of low-energy accommodations, join forces. And very quickly, the campus idea resonated with the Health Summit individuals, and that's where we are today.
Losing our hospital is an existential threat. So we have to come together as a community in order to solve that, in order to address that need. And as it so happens, we have strong relationships with people and groups that would provide funding to help put up another complex.
The challenge was to find a location to build this healthcare campus, and the property identified as most ideal is 5355 Cherry Creek Road, a parcel of land directly behind the No Frills grocery store, and a patch of land that is currently part of the ALR, the Agricultural Land Reserve.
The land has been sitting in the reserve unused since probably the early 2000s, and now we have another very, very pressing need. And I think for us to get the volume of medical professionals, attraction initially, and then sustainability longer term, we need to go in an area like this where we have that collective group of assets together and managed under one roof.
The entire plan for a healthcare campus hinges on having this parcel of land removed from the ALR.
It's an application to the Agricultural Land Commission by the city, because it can only come from the city, to have the property excluded from the ALR. And it is a matter of, there is this community threat right now. We have to address it. If we don't address it, there's this huge negative impact on our community. So we will be approaching various significant groups in the community, businesses, service groups and what have you. We need all those letters of support that we can get, because it's really important that the Agricultural Land Commission see that the community shares the urgency of this need. We desperately need the housing, we desperately need the hospital, we desperately need to put it all together, and this is a great opportunity for us as a community.